Hello everyone, I'm Dr. Bhavna Joshi and I will be taking the subject creating an inclusive school. In this subject today we will be studying about the types of disability and specifically we will be studying about the visual impairment. This topic is in your unit 2 of creating an inclusive school, BA 218. So let's start. Before starting with the visual impairment, the different types of disability, it is very important to know the meaning of impairment. What is impairment? The term impairment refers to a person's actual abnormality or condition. Impairment is the specific problem with the person's body. Basically, impairment word, whenever we use impairment, that means we are talking about person's actual abnormality. There is some abnormality in the body structure or in appearance of an organ or system functioning. So we use impairment if there is some abnormality with the speech, hearing, sight, or mobility, or any other form or loss of abnormality. So, a person may also be impaired either by a correctional condition, also, like in the case of myopia, or a person can be impaired by an uncorrectable one, also, like the condition of cerebral palsy. So, the word impairment means that there is person's actual abnormality condition which we are talking about. Now this is impairment. Now what is disability? These are the words which we usually use in our day-to-day life, but what exactly does it mean? Disability is the restriction or limitation caused by the impairment. These two words are not same, although we use it as synonyms. But disability is whatever restriction or limitation is caused by impairment, and that is the abnormality of the organ. That restriction and limitation is called as disability. WHO, World Health Organization, defines disability as any restriction or lack of ability to perform an activity in the manner or within the range considered normal for a human being. So according to WHO, what is disability? It is any restriction or any or lack of ability to perform an activity. Because as we discussed earlier, that impairment is related to the abnormality in the organ, with respect to organ. So whatever restriction is caused due to that impairment, the restriction in the sense that the child is not able to perform the activity in the same manner as so-called normal human beings are able to perform, that is what is called as disability. It refers to person's inability or reduced ability to perform a particular function. So basically disability is functional limitation. It is related to functional, that the person is not able to function properly. Now, a person may be disabled physically or intellectually or sensory due to sensory impairment or any mental illness also. Now, we studied about impairment, disability. Now, what is handicap? This is also the word which we use usual in our usual daily life, but handicap is not something which we refer as impairment or disability, but handicap relates to the disadvantages experienced in the society by the individual as the result of his or her disability. Whatever disability the person is suffering from, the experience the person is getting due to this disability, the disadvantage experience which the person is getting due to this disability, this is called as handicap. It is basically society and the physical environment what makes a people handicapped. That means it is the attitude of the society, how society treat the person who are disabled, and that experience make the is known as handicap. So all, not all impairment result in disabilities. One may also be disabled but not handicapped. It can be, it is very important to know that, note that not all impairment result in disabilities, but yes, one may also be disabled but not handicapped. Now, that means if it could be that a person is disabled but is not doesn't experience any disadvantage experience in the society, which means that the person is not handicapped. So these were the basic terms which we use with the children. So now coming to the topic, as per the Persons with Disability Act 1995, disability, according to the Act, disability means any person who is suffering from blindness, low vision, leprosy, cured hearing impairment, locomotor disability, mental retardation, or mental illness. So, all the categories which are stated in the Persons with Disability Act 1995 comes under this word disability. So let's start with the first disability, or we should say impairment, that is visually impaired children. Now, visually impaired children are the children who are not able to see the world with their eyes. So this category is divided into two basic parts. That is, visually impaired child can be totally blind, that is blindness. A totally blind person is one who has the characteristics of the person who has no vision. There is no perception of the objects which are seen. They learn. Du- they learn with the help of braille. Now, persons with disability, low vision means a person with impairment in the visual functioning. That means after treatment or standard refractive correction, but who uses or is potentially capable of using vision for the planning and execution of a task for with appropriate assistive devices, which means that persons with their low vision can do the task with the help of assistive devices, which we will study in our coming classes. And they are able to function after some treatment or standard refraction correction. So now, identification of visually impaired child, how you will identify that the child is having a problem with the with respect to vision. They usually have watery eyes, redness is there in the eyelid, they cover one eye and tilt the head forward. They're not able to see, they hold books and objects very close to their eyes to see. They ask other person to help while taking notes from blackboard. They blink more frequently, squint is there, complain about headaches, has poor eye hand coordination, moves head forward and backward while looking at a distinct objects, because basically because they are not able to see the object, have smaller eyelid and are very sensitive to the light. So next is, these are few tests through which the doctors can identify the level of visual impairment in the child. Now, what are the basic causes of visual impairment? There can be, the first cause can be the developmental disorder. These are the various types of disorders. That means uh, from the birth, the eyes are either one or both the eyes or eyeballs or the skull bones are not developed properly. These are the developmental disorders. There are four developmental disorders which I have written. These are the developmental disorders which are basically due to the problem that the eyes or eyeballs or skull bones, they were not developed from the birth. Um, Next could be, related to journal diseases could be there, like chronic diarrhea is a cause of blindness in rural area, deficiency of vitamin A, hypertension, diabetes, kidney disease also result in visual impairment. Then malnutrition is a very major cause of visual impairment in children. Then there can be injuries also, that means accidents or injuries which result in damaging the eye problems. And then there can be some genetic defects also, that means the defective genes a child gets from their parents or forefathers can also lead to visual impairment. So now, what can be, as a teacher, what you can do, educational provision, what you can do for partially sighted children. Try to use the remaining sight they are having in a very positive manner. Provide them medical treatment time to time. Use closed circuit television. Basically, closed circuit television reader was developed for partially sighted children. That means what exactly it is, it is a camera with a 300 mm lens, and photographs parts of a page of print or project a magnified image on the television screen. The child can see the written part, the print part, or the photographs on the television screen, but in a magnified, elaborated and magnified image, in the form of magnified image. So you can use magnifying glasses or hand magnifier for these children. You can use large print material. Then have provision of co-curricular activities which suits these children. You can use talking calculators are there. Then try to assign minimum of visual task. And the most important thing is that there need to be a change in the attitude of parents as well as teachers. They need to be very positive about the students, about the visually impaired student and their education and their future. Because if these two community, parent and teachers, are positive, the automatically the child will also be positive about his or her future. Then educational provision for blind children. There is no need for special curriculum, but basically a multisensory approach is needed for these children. That means using as many senses for teaching them. The child should be exposed to plus curriculum. What is plus curriculum? Plus curriculum is not about having extra curriculum, but you can say compensatory curriculum. Like, for example, the skill development is very important for these children, because at the end of the day, it is very important to make them independent financially. So now in the plus curriculum, it includes the braille, orientation and mobility. It means that in plus curriculum, it includes teaching the child the use of braille, orientation and mobility, how to move. Daily life skills are taught to them, sensory training is taught to them, social skills for integration, how to talk with people, how to communicate, and use of various equipments, assistive devices for their future. Then a resource room is very important for these children for preparation of material. Teaching plus curriculum, that means all these extra things, or extra I would say compensatory curriculum. Then locating the braille material and remedial teaching also. So it is very important that the school should appoint a resource teacher, um, uh, who who is not basically, see, a resource teacher, do not confuse the resource teacher with the with the subject matter specialist. A resource teacher is the specialist for teaching skills. That means they know how to teach the students who are blind or who are partially sighted. So they are specialists in teaching skills, not in the subject matter, as a subject matter specialist. So resource teacher is very important for these blind children. Now these are the various equipments which are necessary for resource room, as we studied, like braille writer, slates, abacus, braille sheets, classroom furniture, low vision aids, large print books, braille bulletin boards, hammer, saw, piler, etc. for teaching industrial art, tape recorders, cassettes, braille type teaching aids. All these things are very important for the resource room. So I hope you all understood in detail about the visually impaired children. Thank you so much.